Hi, I'm Dr. Jeff Albert. I'm a sports medicine specialist with Resurgence Orthopedics in Roswell, Georgia. Today we are going to be talking about rotator cuff injuries and treatments. Rotator cuff injuries usually occur by two means. One is trauma. If someone falls from a height, they can have a rotator cuff tear from the injury. Or the most common is just repetitive overuse. As we get older, the tendon starts to degenerate, and with use over time, it can actually tear. When I see a patient in the office for evaluation of rotator cuff tear, things that I look for are range of motion. Oftentimes the range of motion of the shoulder is limited. I try to have the patient raise their hand above their shoulder level. And if the pain occurs about halfway up, it's a pretty decent indicator that you could have rotator cuff tear or injury. And then the strength, we'll test the strength of the rotator cuff tendons. And if there's any weakness or any pain upon testing for the strength, these can be indicators that a rotator cuff has been injured or even torn. Surgical treatment is done arthroscopically, where we use 3 tiny poke holes and a very small scope that enters the joint. We're able to do the rotator cuff repair. Postoperatively, we place folks in a sling for 4 to 6 weeks, depending on the size of the tear. And then we begin physical therapy 2 to 3 weeks after the surgery. Total recovery is around 2 to 4 months.